Hello, my name is Ryan Salachi, and for the last 20 years I've been teaching doctors on the proper utilization of surface EM and range of motion technology. Today I'm going to be covering the Myovision system and how it's successfully used to help build, grow, and sustain your chiropractic clinic. The fact is, chiropractors with the largest client base continually grow their practice through attorney referrals. PI attorneys work with hundreds of accident victims each year. So as a chiropractor, one of the first steps to acquiring these patients and start growing your practice is to be able to differentiate your clinic from the others. And the best way to do this is to give attorneys what they need, something they can't get from any other medical profession. And what they need is objective data that substantiates injury. Chiropractors are the experts in soft tissue. And now, thanks to the new Myovision DynaRom instrumentation, chiropractors are able to document with diagnostic certainty soft tissue injury even when the patient has a normal range of motion, MRI, or CT scan. Let's take a look at a Myovision DynaRom scan being performed and see why it's the gold standard in injury evaluation. Myovision's DynaRom is the only diagnostic tool on the market that combines range of motion and dynamic EMG. The top graph there in blue and white is a dynamic EMG. It's similar to, but more sensitive than an EKG. The bottom graph is range of motion. By combining dynamic EMG to range of motion, the Myovision DynaRom has increased sensitivity and specificity to a level to evaluate injury, meaning we could tell if the patient's injured or if they're not injured. The objective data gathered by the Myovision DynaRom system allows you to communicate your findings with attorneys, patients, jurors, insurance companies, and IMEs. Because the Myovision's DynaRom validity has been established in the Superior Court, it therefore establishes the Myovision DynaRom user as an expert in soft tissue injury evaluation. This is going to help you connect with attorneys, obtain more new PI patients, and give you the opportunity to convert those patients into wellness patients. Because combining dynamic EMG with range of motion increases sensitivity and specificity, the DynaRom was included in the AMA's guidebook, the Practical Guide of Range of Motion. Here is an illustration featuring the DynaRom in the AMA's guidebook. The primary author of the book, Dr. John Gerhardt, described the Myovision DynaRom as brilliant. And it is brilliant. It augments range of motion by assessing effort. It documents guarding in response to pain. It could even differentiate between acute and chronic injuries. These are things that traditional range of motion just can't do. So let's take a look at traditional range of motion. I start with traditional range of motion because that's what every chiropractor that's not utilizing the DynaRom system is using to document their patient's injury. In this graphic here, the striped pie is the normal range of motion. The solid pie is the patient's range of motion. So lumbar flexion normal is 50 degrees and the patient did 51. The lumbar extension is 20 and the patient did 19. So what do you think the results of this ROM only test tells patients, jurors, attorneys, IMEs, insurance companies? It tells them that the patient's fine. The results are normal. But they're subjective, and this is why range of motion on its own lacks value. I spent the weekend scanning about 20 patients or so at a seminar, and almost all of them had normal range of motion, yet they all complained of pain. In your office, you're probably seeing a ratio of about 40 to 50% of your patients producing normal range of motion, although they're complaining of pain. I was so glad that I used the DynaRom, because without it, I wouldn't have been able to substantiate their complaint.
Begin scanning.
Let's take a look at a patient here being scanned with traditional range of motion. Here you can see that the patient has a normal range of motion. They did 54 when they should have done 50. Now we take that same patient, but we use the DynaRom.
Begin scanning.
Okay, what you're seeing here is the bottom graph is range of motion. And these are degrees over here. So anytime it passes 50, that would be a normal lumbar range of motion. So the patient has a normal range of motion. The top graph here is the dynamic EMG, and this is measuring muscle function. You see here where the readings spike up here? This is an absence of the flexion relaxation response. This is a reflex that can't be faked, and an absence of this reflex could distinguish between those in pain from those that aren't with good accuracy. An absence of this reflex is considered muscle guarding. So how is documenting muscle guarding going to help you? Well, it's going to help because it's going to increase impairment ratings by 5 to 8%. It's also going to take opinion out of the equation. The other side will have an MD giving their opinion that there's no muscle guarding. Here, Dr. Benter in her decision based her opinion that there was no muscle guarding. But you're going to have objective data. and objective data wins over opinion 99% of the time. By increasing impairment ratings, you add value to your patient's case. You attract attorneys and you increase settlement. Doctors are reporting that after utilizing the DynaRom, that they're no longer being asked to cut their bill. It's a win-win for you and your patient. It's mostly due that we're getting 10 times greater settlements for your PI cases. In this letter here from Casey Law Offices, you can see the original insurance company's settlement offer was $1,500, but after being presented with the DynaRom information, it settled for $13,000. In another case, they offered $500, but it settled for $30,500. So insurance companies know they're going to lose if this goes to court, and then they actually end up settling for what your patient actually deserves. So you can see why the DynaRom is attracting the attention of attorneys. Here's what attorney Mike Maxwell has to say about the DynaRom system.
These insurance companies like to have their cases with no surprises. And when a plaintiff attorney brings in the DynaRom, this machine which can provide the holy grail, that missing piece of evidence, the objective finding, suddenly they don't know what to do. And suddenly the all-knowledgeable Oz, the great orthopedic surgeon, is exposed. And that really is the benefit of the DynaRom. And if it's the usual, well, I've used my range of motion finder thing, and I found that there were muscles in the back that were spasming, then the defense attorney says, well, that's all subjective, isn't it? And then the chiropractor says, no, it's completely objective. And the plaintiff has lost the case. So this is why I want a chiropractor who can make use of this, because it really eliminates all of the lack of objective.
The DynaRom proves the presence or absence of injury. It substantiates your patient's complaint. It increases impairment ratings and increases settlement. It attracts attorneys and new PI patients. It documents guarding. It keeps you from cutting your bill. And it also has billable CPT codes. The codes you'll be using are 96002, and that's for performing the exam. And you bill about $50 for that, and then 96004 is for your interpretation. You bill about $200 for that, for a total of $250. Not bad for a 5-minute test. See, the nice thing about it is it takes about the same time to do this as it would to do your range of motion by itself, yet pays 5 times that of range of motion. So if you're saying to yourself, this is great, it's a lot of information, I hope that I would use it all, and a product is only as good as its support, well, we got you covered. Welcome to the Myovision member portal. Here you'll find 24-hour access and find everything from CPT codes, court records, research papers, exhibits, depositions to high-resolution graphics for your marketing efforts. It's all there and it's all for you. Let's say, for example, you or your attorney want to know the best way to do a deposition on an expert witness claiming the Myovision's DynaRom lacks credibility. Well, you would just click here and you'd find that article. This is great. You just get started by asking the expert witness, please read your statement with regards to surface EMG in your IME report. What does the AMA stand for? Do you recognize publications produced by the AMA in general as a source of reliable and credible information? What is a CPT code? Are you aware of a CPT code for dynamic surface EMG? How many digits is the code for dynamic surface EMG? Are you aware of the requirements for the AMA to provide a 5-digit CPT code? So you can see where we're going, right? It's fantastic. This is why the DynaRom has established a chiropractor as the expert in soft tissue injury evaluation. But support doesn't end in our member portal. You'll also have world-class technical support built right into the software program. It's so easy. Just click Help and then Remote Support, and get connected in less than a minute. It doesn't get any easier than that. Our technical support staff will make sure that you're always up and running. Our experts can handle any interpretation and depositions you have. Our experienced group of professionals with a record of unsurpassed settlements and court victories are available to make sure you and your patients are getting the largest possible settlement. And our marketing support with our new Skype HD allows us to effectively market the value of the DynaRom to PI attorneys for you. You will impress the attorneys with the new Techno presentation using Skype HD. One of our world-class experts will do the presentation for you. You sit back as we illustrate the clinical and legal value that DynaRom's adding to your cases. You are the expert in soft tissue injury evaluation. Radiologists use MRIs, cardiologists use EKGs, and now chiropractors use the DynaRom. You now have the tool, the resources, and the support you need to start successfully growing your clinic today. And remember, MDs don't want to touch patients. Physical therapists just want to treat. So the doctor that owns the Myovision DynaRom owns the soft tissue injury market. Thank you for your time.